I am Zakria Abdalmomen, joining you from Saudi Arabia this time. And it's a great pleasure to do this again. We have with us Honorable Minister Mary Issac, the Minister of Health and Wellness of St. Lucia. I'll let her try to introduce herself, the Honorable Minister introduce herself, and the kind of hopes that she has for her beautiful island nation and for the Caribbean as a whole. You have the floor, Honorable Minister.
Thank you very much. Good morning, everybody. First of all, I want to make a correction that I am the former Minister of Health and Wellness for St. Lucia. I also am not sure if Dr. Cooper is on this call, but I want to say thanks, especially to him. Without his intervention, I would not have had the honor to be at this forum. And I want to congratulate him on his nomination as a Nobel Prize nominee for 2022. I believe it is quite an accomplishment, especially for the area of mental health and for world peace. I think that oftentimes mental health is disregarded in St. Lucia, for sure it is. And there is a stigma attached to persons with mental illness. In our society, it's a very small one, 270,000 people. And you may well understand that most people know each other. And it's very, very easy to find out who is experiencing, issues in terms of mental health. And with that stigma, it really does not help that population of individuals. So most times they are ignored. They lack the resources to take care of themselves. They do not have the necessary assistance. And oftentimes they find themselves on the streets with nowhere to turn and so on. We have one mental wellness facility in St. Lucia that can house anywhere from 60 to about 80 persons at one time. And up till recently, everyone was placed in that institution, regardless of their age and regardless of the degree or the severity of their illness. So while I was Minister of Health, we were able to improve the facility to include an adolescent unit for younger persons who were being admitted in care. But by and large, most of the patients are out there, and have to look out for themselves. Because of that same stigma, family and friends often do not want to associate with these people. They do not want to be seen associated with these people. They do not want society to know that these people belong to them, these people are family, these people are friends. And therefore that adds to the stress that mentally ill persons experience. While I was Minister of Health, sometimes we would have persons being picked up by the police when they get out of control or, when they do not take their meds and so on. So they would be picked up by the police, and the police is not trained to take care of, to know how to handle persons with mental illness. They handle them like any other person, any other criminal, any other, and they would end up taking these persons to the mental wellness center, only to be told that, persons must be referred to the center, not just taken there. So then they would take these persons to the hospital, and the hospital would say, well, this person is not, we do not know what is wrong with this person, and therefore we cannot admit this person. So very often there's not a place for persons with mental illness even go to unless they've been diagnosed with, with a particular illness. So you find that we have a homeless shelter also. It's very small. It's just a home that was donated. And it's often quite full. So again, the level of care that is needed for persons with mental illness is just not available. And a lot of these persons, if they were to get intervention before getting severely ill, some of them could get back to having a normal life and be in society and everything else. But we just do not have the level of assistance that is necessary to assist persons with mental health in St. Lucia. And I believe that goes for most of the Caribbean. So I am going to stop here in case, anyone wants to ask any questions or wants some more information or something about how we really treat our mentally ill persons in St. Lucia.
Well, thank you for that brief picture. You touched upon a few topics that I'd like to discuss with you today, including professionalization, training, stigmas and stereotypes, and definitely quite a few things I want to ask you about. Now, while you were Minister of Health and Wellness, we saw quite a bit of increase in investment and input into the health system in St. Lucia. But do you still see underinvestment as a big challenge in St. Lucia and in the Caribbean?
Yes, I do. And the main reason is because there's not sufficient attention given to the whole area of mental health. It's like something that is considered when everything else has been taken into consideration. The finance that goes to mental health is more or less piecemeal, and it is not regarded. It is not. It's not taken as on a holistic level. So we go from stage one, where a person is starting to experience issues, and go all the way, have a program in place to handle that person, that patient, until that patient is well, gets back to wellness. Instead, it's more or less you do as you can, and it's left to family and friends and so on. So there is not enough investment in mental health simply because it is not taken seriously. It's not regarded as an issue where it is important for persons with mental health to come back. They contribute to society. They can contribute to society if we are able to get them well and back into society. It is not looked at that way. It is more seen as though they are a burden to society. So why put resources into what is considered to be, almost like a waste of time, a waste of money? And this is why we have to keep trying to get governments to understand that mental illness need as much attention as any other area of health.
Absolutely. And with that attention is not just investment, but a lot of planning as well. You touched upon stigmas and stereotypes. There's quite a lot about that because stigmas and stereotypes are also connected with training. As you've mentioned, stigmas also exist in the police forces that do handle some cases regarding mental health, and then also of the health professionals in the hospitals. So what do you see in the future for the Caribbean and its cooperation with the rest of the world in planning out training procedures and training sessions and courses for the professionalization of the healthcare system and of the police force and public entities?
Mm-hmm. I believe as much as WHO and PAHO pay attention to health and healthcare, I believe other international organizations have to come together to emphasize on the need for education about mental health and to try to encourage countries, because I don't think that you as an international organization can force any country to do, what it is that they're not really serious about. But we need these organizations to put pressure on governments so that they can, take mental health more seriously, put more, like you're saying, put additional training for persons who interact with persons with mental health illness. For instance, the police, have a cadre of police that are properly trained to handle such persons. You need to have sufficient psychiatrists, psychologists, the clinical health persons to deal with issues of mental health, even before they become a real big problem, so that you can curb on the number of people who become severely ill, severely mentally ill. And we have to be able to get these outside organizations to come in and to bear on and emphasize on these governments the need for programs to take care of mental health people, especially education. Because when you have such stigmas, you need to educate not only the persons who handle these people, but the persons who interact with them, and your entire society need to develop a level of sensitivity towards persons with mental illness. So this is what international organizations can do for small island states, because we're so small that when people go about business without caring, without an overhead organization to put pressure, then nothing really gets done. But when you have international organizations putting pressure on countries to do what is necessary, then you see a difference in terms of getting professional programs in place, getting the necessary training and the necessary planning, because we get funding from outside sources and from international organizations, and they can attach certain conditions to that funding to ensure that mental health is covered and in those country programs.
Absolutely good points. Now, a lot of that change of thinking within and education within the public, I think a lot of that has to do with community-based and grassroots-based movements, and as well as education. On the community level, what are your thoughts for development in education on mental health?
Well, at the community level, I think we need to have NGOs, develop the NGOs that are going to then champion the cause of mental health patients and mental health in general. But you understand that NGOs, since there is that stigma, it is difficult for those NGOs to get started, and they would need the necessary support so that they do not bow to political pressure that would stop them from, representing mental health patients and from doing what is, or asking, requesting, requiring what is necessary for countries to take care of mental health persons. But I think NGOs can play a very critical role if they have the necessary support, the necessary financing to really get them started and get them organized, the training as well, to get them organized as NGOs representing, mental health.
Well, that challenge with NGOs is definitely felt globally at an astronomical rate. Now, you've also touched on education for the public, but I also want to focus on education within schools. Now, St. Lucia and the Caribbean has sort of a challenge when it comes to mental health support for students. What are the sort of ideas, like, for example, mental health counseling and so on, that are sort of floating around for education in St. Lucia and the Caribbean?
On paper, it looks very good that we have the mental health, the support. We have counseling in schools, we have special needs schools. And like I said, on paper, this looks, up to a level, up to a standard. But what is on paper is not materializing in actuality, in real life. And you still have the need for special schools, special education, to educate persons, as well as to be able to take care of persons, to take care of the education of persons experiencing mental health issues. So it has to be a two-pronged approach, where you have the education being done in the schools, and that's part of educating your public, your population. So you have programs to educate students in schools to help them to understand the issues surrounding mental health, the challenges surrounding mental health, and even with their own peers in school, how they have to go about, handling that. So the education has to be done at the school level, as well as for the government to provide the necessary resources so that the school system can provide for persons with those sorts of issues, for students with mental health issues, and not just, have them get out of the school system and they sort of put aside. They do not get the necessary education that they have to get once they start developing mental health issues. And of course, the stigma then kicks in and makes life more difficult for them to get an education or to continue their education. So it has to be a two-pronged approach, where the education is being given to persons in school to understand the whole issue of mental health and the challenges, as well as to be taking care of the person who is having those challenges, and to help the person to continue to be a holistic person who can contribute to society.
Absolutely. That basically covers the whole round of the issue, making sure those children are taken care of while educating them, so that they can grow up to not have those stigmas as the rest of the current public do. Thank you so much for that. And as a reminder for everyone, you can ask your questions on this on here on Zoom, or you can do it on the comment section of our Facebook Live, which we are keeping track of. So thank you in advance for any questions that are posed. Now, I do want to touch up on global climate change, as St. Lucia is a Caribbean island, and it is quite vulnerable, especially vulnerable to climate change. And as COP26 recently ended, do you think that there has been a proper amount of international attention for the effects of climate change on mental health, or what do you think what more could be done on being more attentive towards the effects of global climate change to mental health and health in general?
Definitely, there has not been sufficient attention placed on mental health. At COP26, I did not get the sense that it was an important topic, and that usually is the case. It's usually just it's almost like a side, a side event when the discussions on mental health takes place. And when you're looking at global when you're looking at climate change and the impacts, especially on small island states where you have the hurricanes, those disasters, sometimes resulting in lack of drinking water or a reduction in the availability of water and so on and so forth. What you find is these people who are already marginalized, who are already challenged more than your ordinary citizen in society, are the ones who are really left behind and left out of the assistance, if any is given. And they are really not considered in program planning and care under our climate change agenda, in our whole climate change agenda. I do not, well, from a small island state, I do not see much emphasis on care for persons with mental illness. And again, these people are, thrown on the wayside. They are the last persons to ever be considered, when we're looking at assistance after natural disasters. And in most cases, they are not even mentioned. It's just taken that somebody is going to help them out somehow, somewhere. So there is no real planning, even if there might be planning on paper. As you mentioned with COP26, there might be something generated from that gathering, from these meetings on paper, but it does not redound to providing additional care or assistance in reality. So that is a group that really need to be, I don't want to say we need to, because the paper is there. It is there on paper. There's a lot that's written on paper, but it does not translate to care for them in reality. And that is one of the problems.
There's definitely a difference between it being on paper and in practice, especially when those such ambitious plans are put into place on that massive multilateral stage. It seems that populations are just seen as like a number instead of individual stories and people.
That's right.
So, that is certainly a challenge. Now, there has been many challenges in the Caribbean, from recent natural disasters to the COVID-19 pandemic, to hits on the tourism industry, to climate change. There has been the Caribbean has not been short of any challenges, and I just want to discuss with you on that community level and on that national level how people are managing throughout their day-to-day life in terms of health. I just want to hear about the challenges, the day-to-day challenges that St. Lucians face. I think our viewers would really love to know those challenges and get the sense of the daily people of St. Lucia.
I mean, well, like all other countries, we have really felt the burden of COVID-19. And at one time when it started, like most people were thrown off guard and did not expect it to last as long as it has lasted. We thought it was something like maybe a chikungunya that would come and go, and all these others and so on. But well, it has really caused a big dent in our revenue collection. And as you know, mental health is always at the end, the very end of in terms of care and so on, at the end of the spectrum. This is not even an area that, we think much about. But I think that we have done fairly well. We had very strong protocols in the beginning, where at some point we actually had to shut down the entire country. But I think we only did that on one occasion, where we had completely shut down for about 14 days. After that, we have had different levels of restrictions on island, but we have fared very well. And now at this stage, we are able to only have curfews from 10 p.m. to 4 a.m. in the morning, restricting movement so that, you know, frontline workers can really do what it is that they supposed to do. But it has mostly really affected production as well as revenue generation, because we are a high tourist. We depend highly on tourism in St. Lucia, and closing down your borders means the tourists are not coming in and your people are out of work, you know, and that has a rippling effect all the way down to the common man on the streets. So we saw quite a difficult time when it started. But in terms of casualties, we were able to keep the casualties very low up till around July of this year. We had just a few persons deceased as a result of COVID-19. Our numbers in terms of infection were still very low. And of course, that escalated after we had our general elections in July because of all the campaigning and people coming together. So what you find is that we started having those spikes. And now we have a little over 200 deaths we've had, unfortunately. And that's a very sad thing for a small island with only 170,000 people. You can well imagine when you lose one person, most people in the country somehow are associated with that person or know that person or know of that person. So it hits us really hard when we lose a loved one here in St. Lucia. But we are more or less open to visitors now, and we follow protocols, wearing our mask, and sanitizing is a big thing here. So, and lucky for us, we have not had a natural disaster. Usually in the hurricane season, we have those bad hurricanes and so on, and we were spared, you know, this past year. We have been so far, and of course, knock on wood. But I believe that we have fared very well, and people are more conscious and aware of the fact that we have a pandemic and they must take care of themselves, because, you know, care starts with you first, especially when it comes to COVID. The general public is very aware that they have to protect each other. And as such, I believe we have a very high level of adherence to the protocols that government sets on a regular basis, on a weekly basis also. So we have not had, we have not been impacted as badly as so many other countries that I know, where thousands of people have died and so on. And I must say that especially in the beginning, my administration was really able to lock down on this whole notion of protecting the people and putting lives and livelihoods first and foremost before we think of, you know, the economic impact of COVID, which is very devastating in itself. So we have done very well, I believe, in St. Lucia. But the economic impact of COVID is felt, and it's throughout our society. Of course, you know that we import a lot of what we use, and when supplies were not forthcoming, then, you know, construction and building and so on, activity on island almost came to a standstill. And again, that created another level of economic economic depression. But by and large, I think we are bouncing back, and we see the tourism sector really picking up, and life is getting to be, more and more normal, pandemic normal, COVID normal, because we really have embraced what needs to be done to keep our people and our population safe.
Well, it is quite commendable and encouraging to see that when all odds, most odds are quite stacked up against you. Now, another reminder, I'm still checking the questions on Facebook Live and here on Zoom. If anyone would like to pose a question, you're more than welcome to. Now, since COVID-19 for most of the world is winding down, what sort of is the plan for the near future in terms of mental health? Do you think that the current administration has? Do you think that there's been any changes in the prioritization of mental health in recent years and with this administration?
I don't think this administration is very conscious of mental health and all its implications to economic development, as well as to your health programs and your health agenda. There are quite a few pockets that are ignored when you have governments in office that do not really care about people as much as they care about their pocket, as much as they care about generating revenue, and doing things that will bring money and so on. As you know, health hardly ever generates revenue. Only if you have health tourism, and this is an area that we've been talking about, but we have not really explored. Going into, health tourism. That could be an avenue for revenue generation. And when that happens, then you may have sufficient funding to trickle down to mental health, because it's always a matter of what is left over that will go into mental health. I do not think this administration is sufficiently aware or educated about mental health to make it a priority. I hope that we can come up with an NGO that is going to start looking at the area of mental health. And I believe it is more a challenge. It is such a challenge for government in a small island state that it would depend on an NGO to come in and rally and agitate for resources to put into additional resources to put into mental health in order to make it better. Under my administration, I was already rallying for government to start looking at community health, community mental health. So we were looking at, instead of having everyone in one big facility, away from their family, away from their friends, away from home, we were looking at putting smaller structures, smaller clinics, smaller facilities in the small communities, so that mental health persons could be housed and taken care of in their own community. We have a level of mental health, community mental health, but it's only to go to the clinics and get assistance from the clinics. And if there is an issue that is above the level of what is offered in community clinics, then it is taken to the larger facility. But what I was really trying to accomplish was to have mental health facilities on a smaller scale, in smaller communities, so persons with mental health will get the assistance in their own community. And if they so wish, if they need to be housed or sheltered in a facility, that facility would be in their own community, where their families would be able to assist in caring for them. They would feel that they are still at home, and that would put them in a better state of mind. In a small island like ours, that is not very difficult. A home can be retrofitted, and you can provide that type of service. But of course, you would need the necessary financing, and it would again depend on government to provide that level of financing, which I don't think this government is going to do.
Well, thank you for that input. Well, internationally, I could speak for a lot of people that we really hope that there is more attention and change within the near future. Thank you so much. And just one of the final points is that while you were the Minister of Health and Wellness, there's been a lot of talk about more financing for public health care and universal health care coverage. Now, how does mental health fit in those plans for St. Lucia while you were a minister, and for the current administration and for future administrations? What do you think the sort of prioritization is of mental health in universal healthcare coverage?
While I was in office, I caused my ministry workers, the administration, to regard mental health as another program of health. So mental health patients were regarded as any other patient. You need care, you would get the level of care that you needed and be treated humanely, while you get that care. We were considering universal health care. Well, a level of universal health care that would provide medical care for everyone, supported by government. So we had not devised the method of financing that universal health care, whether it would have been through taxation, or some other way, through our medical tourism, because this is an area that we were really looking at very seriously with a new hospital that we have, where we were looking at providing medical tourism through that state-of-the-art hospital. And of course, hoping that that medical tourism would, like I mentioned before, finance other healthcare areas for us here in St. Lucia. That would be a plus, definitely, especially for mental health. And we would be providing that healthcare insurance, so everyone in our country would be covered, would have insurance coverage. And that would encourage people to get care early, rather than waiting until a problem develops and then go and get care to take care of the problem. So you're looking at preventative care. We were going heavy on preventative care, as opposed to taking care of the tail end of health problems. And hopefully that would have redounded into us being a healthier society, because when you have healthcare available to everybody, without them having to find the finance to pay for hospital visits, to pay to visit the doctor every time, especially in a poor society, then it sort of encourages people to take care of their health before they really have serious health issues. So this is the sort of universal care that we were looking to offer. And of course, not separating mental care per se, but incorporating it into the whole idea of holistic health and holistic care for persons, because we were emphasizing that regardless of what your illness is, you have to be seen first and foremost as a person in society. So you would be able to access care regardless of what the issue was. And that in itself was a way of removing the stigma that is attached to mental health, because everybody would be exposed to or would be entitled to the same level of care that government would offer. So I believe the way forward is for us to continue to provide medical insurance for our populations so that they do not use finance as a restriction from accessing healthcare. And that would go a very long way.
It absolutely will go a very long way. Now, as the government of St. Lucia is a democratic country, do you think that there needs to be a sort of wide change within the public in their thoughts towards mental health in order for the government to really start prioritizing it?
Definitely, and that is where the NGO would come in, because the public on their own will not just start thinking of changing the way that they regard mental health. So what you need to have is some entity that is going to force the public or educate the public into understanding what mental health is about, and that anyone at any point in time in your life can be someone who starts experiencing mental illness, you know, and with that, the pressure would come to bear on the rest of the population and government. But you have to first get someone or an agency, or somehow you have to change the way that people think of mental health and the way that they see mental health. And once you can get your population to start developing the level of sensitivity that is necessary for us to address the issue of mental health, once you can get that, then the population will put pressure on government. And automatically, of course, government is part of the public as well. And they too will start understanding the message. And hopefully that will bring about better care and, you know, better programs for mental health. But right now it's just not happening.
That is quite sad to say, I'm sure. And now I would like to get to one question posed on our Facebook Live. I do encourage all of you to ask any questions you would like regarding mental health in the Caribbean and in St. Lucia. Now, the first question is, do you see a mental health training as having the right focus on resilience to avoid a crisis?
Definitely. Any training in terms that will improve on people's thinking about mental health, any training that is going to start, you know, breaking away at the stigmas that are attached to mental health will assist in terms of, you know, diverting crises and stuff like that, you know. But definitely training, definitely education, you know, these are the real starting points, you know, because even if you put a lot of money into it and the money is not focused in the right area and in the right direction, it's just going to be a waste of resources. You first have to ensure that the training is there and the education of the people, the general population, towards mental health care.
Absolutely. So this is quite a multi-layered situation, isn't it? All the way from community-based organization and NGOs to international NGOs, to the stigmas of the general population, to the stigmas in public services, such as the police, the hospitals, the clinics, all the way to the legislative entities and the national government. So there needs to be, so if I understood you correctly, you're thinking about a proper professionalization and training within all of these layers to put more attention and more education from schools to communities all the way to on the national level and international level.
That is right. That is definitely what has to happen for us to see the change. Yes.
Well, that is quite ambitious, but if it isn't ambitious, then it's not worth it, is it?
That is right. And we have to start from somewhere and aim for, a holistic change in the whole area of mental health, because it's not happening in the Caribbean at all. And a lot of people are perishing as a result of that. It is really a necessary in our part of a necessity in our part of the world. The education and the training in terms of mental health and the challenges that are posed in the mental health, in the whole area of mental health. We really, really and truly need the training and the education so that we can change the mindset of people and change the way that even the professionals who deal with mental health persons think and behave. So this is what I'm seeing right now that we need most of all. The training, and I don't think government is just going to on their own in small island states decide, hey, let's provide that training or that education. I think the pressure has to come from outside and be, imposed upon those small island states to understand that there is a need to make that change in terms of mental health.
Well, there is definitely a need. Thank you so much for being with us today. If we don't have any other questions from the audience, we will end it here. Thank you so much, and I'd like to welcome you to the organization, to the World Leaders for Mental Health. If any of you have any questions or concerns, I have sent the email to the chat and on our Facebook Live comments. Please contact us at info@peacefulmind.org. If anyone has any questions or concerns, we'll get to you as soon as we can. Thank you so much, Honorable former Minister Issac, for joining us today. And it was an absolute honor. And thank you, Tanvi, for providing us some technical assistance on getting this meeting up and for having it on our Facebook Live. And I would like to thank and congratulate Dr. Kapoor for organizing this, getting us together, and for his nomination for the Nobel Prize. Thank you so much to also our audience for their attention and for being with us today. Now, before we end, I think we have one more question. Usually I don't pose them at the very end, but this one is quite an important question. And then we'll end it there. Do you believe, from Dave Sleet, do you believe the island administration would accept support?
Definitely they would, especially if it's coming from an international organization. They definitely would. I mean, you would have the expertise and you would know exactly how to craft and frame such assistance. So they definitely would. And, I mean, I can always influence that if needs be.
All right, great. Thank you so much for answering the questions from us and from the audience, and for being with us. I hope that you have a lovely day. Thank you so much, and enjoy the rest of your weekend, everyone. We do have another event next month, our end of year event. I look forward to seeing our audience members there and our viewers. Thank you so much for joining us again, and for the audience as well.
Thank you. Have a great day, everyone, and thank you for having me on this at this session. It was very informative. It caused me to think a lot, And let us continue to see how best we can struggle and assist persons with mental health in the whole world.
Of course, that is our mission. Thank you all, and have a nice, good evening, good night, good afternoon, or good morning from wherever you are connecting to us from.